the higher you could sing. And if you ever take voice lessons, they tell you that you're not only not going to do a good job, you're actually hurting and damaging and tearing your vocal cords. And they train you in voice lessons that I never had, and you guys I don't know what will, but they do. I do know they train you when you sing. Your head is always straight. Why? Because you want your throat to be as open as possible. And if you go like this, you're actually bending your straw. You're bending your throat, and it's not clear. What you should focus on is your breathing. And instead of looking up, take a deep breath, like someone said. And then you have a lot of more energy without me stretching and straining, which I did take voice lessons for singing. But because I do a lot of talking in Hebrew school, I actually had to get therapy, voice therapy. And I had to go to the LIJ for 10 lessons, 10 weeks to practice breathing and speaking, because I speak a little too fast, and because my vocal cords were damaged. My father too is a 7-year-old fellow. I saw him this morning from Montreal. He came to New York, and he's a teacher, and nowadays we have microphones. So instead of yelling at the class, we could talk lower and be in the microphone. That's very important to know. You're getting voice lessons part of the CPR certificates. All right, so you want to make sure that the head is back. If we're 2 people CPR, which is better, it's easier, then one person will stand by the head, and you're going to help whoever's giving the breast, and you're going to hold the head back with 2 hands. If you see how I'm doing it, it's a specific way. I'm putting my fingers below the jaw. It's very easy to open the mouth if we push our jaws to the side.
Wait, when do you do that? After how many?
Before.
Oh, we'll get that in a second. I'm just going to show you how, then we'll talk about that.
It's first thing. First thing.
Okay, why? Because if you didn't see what happened and you weren't there with Landon, fancy, bringing him down, likely there's a head injury if someone fell. And if you touch your head in the wrong way, you could damage or further damage the person. So we have to open his mouth without moving his head. And we can't do this now when we're sitting, when we're laying down. If you put your hand, I know it's hard to see by my beard, but if you look for your jawbone, you could push the jaw when you're laying down, and the jaw will naturally make your head straight, okay? And that would usually be for 2-person CPR. It's very important to have a seal, okay? So this is easy to do. It's a mask. When you put it on, what does it mean it's a seal? Because it's right there, you see this opening. You go for Chabad, C team, make your hand the C, and depending on if you're 1 person or 2 people, if you're gonna do like this, your hand is down, and you grab a seal, right, not on his face, but to the side of his face, to press down, that it should be fogging up versus air leaking, and then you give the breath. Okay? We'll get to them out in a second. For a child, what are you gonna do? For a child, life hack, they have these in small, but maybe you won't have it. So what you do is, if this is too big for their face, what we do is, there's nothing coming and going from the eyes, so we can actually cover the eyes, and you turn it upside down, because this is too big around baby's mouth, right? We turn it upside down, and the little mouth could fit in this part, and you're just covering the face, so there's no air going, because the eyes, right? The nose is important, because the nose is where we breathe from. The mouth and the nose is connected. Okay, so for our infant, we're turning it upside down. Okay, so body's down. We know how to breath. We know how to check for a pulse. Now we're actually doing CPR. Now this is where Hebrew school comes in, and where Judaism really, you know how they say the Jews control the world? It's true, right? They say it. So listen to this. There's a Hebrew word for heart. Who knows it?
Lev.
Lev. We have some Israelis here. And what is lev? You know what Chai is? Chai is 18, right? Yesterday, I'm still in kayak. I'm still in kayak from yesterday. But yesterday was kayak 28, the day the Rabbi came to America, 1941, right? So we have numerical values. So what is the numerical value of the word lev, heart, in Hebrew?
32.
Isn't that cool? CPR is
32.
Copy listening? Robinson? 32. It did change many times over the years. 15 to 2 or this or that. They say 32 for an adult, but then 52 for the baby. A lot of it changed over the years, but of at least the last few years, last 7, 8, 10 years, it's stuck to, and it could change again, but for now, it's 30 to 2. For adult or babies. How cool is that?
30 compressions, 2
Left.
breaths.
30 times, 2 breaths. Now we're going to show you how hard and fast, and it's very important.
That's really cool.
When you're by yourself, and or when you're with a partner, in many cases, in camp setting, be 2 people, just count that loud. Both, if you're alone to know, and if you're yourself, because the person who's going to be standing next to you for a better reaction for the breaths is to know when to do it, because every second counts. And as soon as you say 30, 30, that's how long it takes. So you have the beat. I think there's a new song that came out Not that I know any about celebrities or any about what's that singing contest called? The Israel Wants Singing Place, whatever it was, right? But there's a few songs we set last night on the Zoom. Was with the Shiva boys. We had to find the Yiddish song that has a beat, but that Staying Alive song, it has a beat, and the beat is fast. So I'm gonna show you how it's done, and pay attention also, because I'm gonna go around the room and watch you guys, because it's your first time, you're not trained yet, and you might forget. When we do CPR, something I didn't say yet, and I didn't pay attention to, was you have to lock your arms. Many people, but do CPR, go like this, and you're not doing CPR properly, because you're not putting your back into it. You're like using your elbows as a springboard. You have to keep your arms locked straight, and then you can go. I'm gonna show you how it's done. Ready? I'm gonna say 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30. One, 2, 3, 4, 5, 6, 7, 8, 9, 10, and that's how it's gonna look. How long do we do this for? How long can we do this for?
Until the emergency is coming, the EMT or.
How many? If I ask you to do push-ups, how many push-ups can you do right now? You do one push-up?
12.
Until
12?
you passed out.
Right? How many push-ups can you do? Guys, this is work. This is real work.
Yeah,
Try
it's
it,
hard.
okay? I stopped after 10 because now I would get tired eventually, but according to Red Cross, CPR, all that good stuff, you're out in 2 minutes. You're doing 2 minutes of CPR. You could go longer, and you have to go longer if you're the only guy in the desert saving a guy's life. You do what you can, but when you're with someone or yourself, whatever case is, it's 2 minutes. What's 2 minutes? So let's say we're doing 2 people practically because you need help. 2 people. You're doing 30. 2. Now, it doesn't take me 30 seconds to give 30, because if you're counting seconds, I was counting seconds, I was going fast, right? So maybe I'm doing 3 compressions in 25 seconds, right? So after 2 minutes, we should be doing 4 cycles. 32, 32, 32, 32. And once you do that, you say switch, whatever password you have going on, and then in that case, maybe the partner will go on that side, not to waste time of, okay, the rabbi, teacher, CPR says I have to be on the left side, so get up, and now you're doing that cup fist, and you're going around the body and circling, and okay, in that case, you just go to this side, and then we'll rotate. It's 2 minutes. We're with each other, right? When you can, you want to be on the right side to go on the left. We'll show you in a second. So you do 32, 32, 2 minutes. Then you switch, and then 2 minutes switch, and then 2 minutes switch until something happens. Okay. Now, something that I skipped, I'm gonna bring up now, is that we got protective equipment. We did all that stuff. We got consent, implied consent, all that good stuff. We checked the pulse. Something you have to do before you get distracted, and your practice training will come in. Before we begin, how long can we do this for? Like you said, right? You're getting busy. I gotta save his life, but who's coming to? You have to. The body. This is just to get you to the next stage. So the first thing, in the corner. So I'm gonna put on you. What's your name? Sarah and Ella. Okay, so Sarah, you're the chief now. You're in charge of CPR. You're about to start CPR. What are you gonna do? What do you need to do?
Call someone.
You're gonna call someone and get your password and
Get someone to call someone.
How? Show me.
Call someone to call someone. Yell at someone to call someone.
Help.
Do it. Don't tell me what you're gonna do. Do it.
Go call 911.
So I know. So you didn't do anything yet.
What?
But nothing happened. Try again.
What?
Get help.
Someone call 911.
And come back to tell me.
So you have to identify
come
someone.
back.
Because if you're a teacher in school, nothing's gonna happen unless you get a command. Nowadays with therapy and everything else, you didn't communicate properly, and we're going. You have to say, you with the yellow shirt, call 911, get help, and you're not done yet until the person says, okay, I got it. So now yellow shirt person is calling 911. Are we ready to go?
Not until they're next to you.
Well, now it's not your problem. You have to get some help. You're starting CPR. But before you do that, one part is call 911. What else do we need to do? We talked about it a little bit.
AEI.
Someone has to get on that phone with
911.
Stargazer,
Astrid.
Astrid. That's like
Stargazer. He's gonna call it
Something big coming. And
That's a nice.
Astrid is waiting for you to call. So I need the AED. Your CPR is fun and games, but AED comes first, which we're bring next, because now we're for CPR. But AED comes first, because the AED will be giving the body it's what it needs. Okay?
Shock.
So you call 911, but you specifically with the yellow shirt or pink shirt, kind of short shirt. If they're all wearing blue shirts, get more typical glasses, tank top, whatever it is, and then you go get the AED. Now you know that help should be on the way, and the AED is on the way. You start. Guys, I got all my Mississippis in. 10, 11, 12, and Landon was doing so good, and all of a sudden, AED comes to the show. So, what am I doing? 11, 12, 13.
You continue where
You stop.
Oh, yeah?
Because this is a little bit better than you. And don't say, oh, my 32, left heart, did I get also? AED's here. Freeze. As soon as you get this to the scene, and this may be my new pack, this is my older pack that maybe has batteries in it, let's see. One of them should have working batteries. Let's try this one right here. And then AEDs, guys, this is what it looks like, okay? It might be bigger, maybe fancier. We're gonna open this up. Let's see what we got here.
Adult patient. If the
Yeah, we
patient
can have
is a
working
child,
check
Yeah,
the
it tells
bag.
exactly
the
what
child
you
button.
These are for dummies,
They
okay?
have to check those
Remove
down.
clothing from the patient's chest.
We already did that, right? Remove
Remove
clothing.
packet and apply pads onto patient's bare skin.
Okay, these are gonna be a little sticky.
Apply pads as shown in the pictures.
His voice is stronger than mine. There's a picture.
Remove
Now it is.
packet and apply pads onto patient's bare skin.
One is going on not
Apply
where the heart
pads as
is.
shown in the pictures.
He's waiting for me to do it. Okay. One
Remove packet and apply pads onto patient's bare skin.
and one below the heart.
Apply pads. Press pads firmly on skin.
See, he knows that I'm here. The wires are connected.
Apply pads as press pads firmly on skin.
And then maybe this has the plastic on this one so it doesn't feel it.
Do not
Right.
touch the patient. Analyzing heart rhythm.
Okay. Sometimes we're touching.
Do not touch the patient. Analyzing heart rhythm.
Make sure.
Shock advised.
Okay, you
Do
heard that?
not touch the patient.
Shock is
Everyone clear.
You have to say clear and go with your hands.
Press the flashing shock button.
Clear. Okay, it's waiting for me to do it. It's instructions.
Press
You have to
the
do it
shock button now.
until you do it. You stop CPR, you stop everything.
Press the shock button.
I finally did it.
Shock delivered. Begin
Right, like you see in the
CPR.
It tells you to do it, and guess what's gonna happen? In
10,
see, it's going fast. Right, I spaced out. I missed 5 already. Right? You're doing CPR,
20,
and it's reading the pulse, and it will say shock, or it will say no
30.
shock
Give
needed.
2 breaths.
Give 2 breaths.
Ooh.
3 to 2, and it's analyzing. That's why you want to get this connected right away when it comes. That's gonna restart your cycle.
10,
Okay. Now, look at this. There's a little picture of a baby, and a picture.
20,
Okay, let's see what happens if I switch it up. Well, wait, this setting actually gives me a few settings of different
30.
CPR scenarios
Give 2 breaths.
that I could customize it.
You'd be okay with showing them ours? We actually have one. So
Yes, you want to be in. They have to know where it is for sure, but definitely show them.
know where it is?
You have to know
By
where
the
it is.
front entrance, by the.
Front lobby.
10,
By the way, this came already connected. I'm not sure. It's something that you might have to connect or plug in.
20,
Okay.
Right, we can't use ours though.
No,
Right.
because
That's just to know what it looks like. Maybe.
yeah,
You
it's
click
you.
the baby.
breath. Child patient.
This is very important. Why? Who can tell me why?
It's different.
Baby is not the same.
So we're giving a shock.
Right?
Sometimes there is a baby pads in your kit. Actually, that's one thing that didn't make it to my car. I also bought a new separate CPR. And I had it remote, but that didn't make it. Not Landon's fault. That didn't make it into my car. But I bought another CPR. I thought I'm not going to get home to see what it looks like because the Spirit's a little different. Maybe it looks more practical
Is this a
because
demo or it's
these
the
look
real
small. No, these are demos,
Right.
but they and maybe they look small. Some of them are bigger. I had another one I was going to bring, but that didn't make it. Which is why I made a few here. Sometimes inside the pads there will be child pads, and child pads isn't that it's smaller, which we'll read about in a second. But child pads would have something in the wire, and that would be to take away the shock. Right now, the shock is for an adult is too much for a child, and that could hurt the babies. So this machine and some of your machines may have a child mode on the machine, and then it will train you for a child. If not, maybe there's child pads that will give the shock small to the child. So here we have some AEDs.
It's in the lobby. When you come into the lobby on the right side, you'll see. When you open up the cabinet, the alarm goes off.
So here's the
Fine.
replacements. Adult for 8 years, something that I bring up. A child is to 8 years or to 12 if it's a small child or not. Okay, here we have the first aid, and then we have our big machines. Guys, this is what a mask would look like. Remember I showed you my mask right here? So most first aid kit should have a mask, and then I'm not sure whose job is in camp, but someone should go through all the supplies, make sure everything's here, because last year something happened, and then camp moved on, and there should be a mask. This is cool, because like you saw here, the mask should be able to, this is built in my thing, but this mask, I also got this my first year, this is not ready to go, you have to open it up. See that? This comes off, this folds in, and there's a little hole in it because if there's an EMT and they're coming with their oxygen tank and giving oxygen, remember I said we don't have so much oxygen, right? We have breath but not so much oxygen. When they come with their tanks, that's higher oxygen, and they will connect it to a wire and let oxygen breathe, okay? So that's how you open it.
Can you
Question.
give breath without the mask? Like when you do like after 30 and you have to do
So the old school is,
You don't
and
have
someone
it.
probably mentioned, so I'll bring it up now. What does CPR stand for?
Cardio.
Cardio. Cardio means the heart, the pulse.
Pulmonary,
very fancy, very hard to use. Pulmonary is
respiratory.
what?
Your heart.
What's pulmonary?
Resurrection.
Lungs.
Resuscitation.
Is the breath,
Yeah.
is the air, and the resuscitation is the act, give them back to life. In Times Square, you have this on, you guys go to YouTube, if you're looking at it, they have actors, or it's real life, videos of these tests in Times Square. You can have someone literally pass out, dying on the floor. A homeless man that is a beard, but maybe it's not as neat as mine and looks a little messy, and people will literally walk over the
Right.
body, and why is that? So there's a few reasons.
They don't
One
have
is,
the mouth.
if the same thing happened in a park, they have the video of the test, that wouldn't happen. Why? Because when you're alone, you realize, oh my gosh, no one's good, it's you. But when you're in a big crowd, it's like, oh, someone else is gonna save them, especially in New York City. Oh, there's ambulances everywhere. There are people who are paid, and maybe FBI is watching Times Square, and they get paid to do this and train, and they'll do this, so it's not my issue. But another more important thing, this is a study that they made, which also changed CPR around, that Javi brought up before. Sometimes you don't know who this homeless person was, maybe it's not a homeless person. You don't want to get the disease. There's so much stuff now, there's immigrants from anywhere, you don't know where people are coming from, what they have going on. So you don't want to get sick. Why should I lose my life and get something that's bad to save this person? And you'll walk away. So after doing these studies later, they took the P out of CPR. That's the pulmonary, that's the breath. And it's just CR. In New York City, not around the country, around the world, in a very high place. Why? Because they said it's more important their heart rate than necessarily their breaths. And we want to keep their heart moving. Even if there's no breath, there's no oxygen, but if there's no heart moving, there's no inside oxygen. And that's more important, and they want you to have the compressions. So don't do mouth to mouth. Don't get dirty, it's fine. But then at least break the ribs, yeah, fine. You always wanted to beat up someone, you have anger in you, let it out. Go do pumps and give the guy his heart rate. And that's why in New York City, not everywhere else, maybe not in the county either, but in a high place like Times Square, they say just do compression, that's good enough for us. That's one of the latest tests, and every few years, they meet up and they have a test. I just got an email now in the fall that there's a big conference. They go to a hotel for a week, and where all the CPR teachers and all the doctors, they come, and there's a KINUS, there's a conference for CPR, and the Red Cross and other companies, they do it all the time, and they always show the new studies and the new things that come out. Okay?
So could you give breath without the mask? Yes or no?
It depends.
So we're trained.
But you want to.
If you're trained, if you gave breath without the mask, that means you don't know how to do CPR. Because as you said in the beginning, you have to be protected. And then you said it again now.
Oh.
If someone's throwing up and you're going to get a disease from
and then
it,
you're gonna get
that means you're not protecting yourself.
But if God forbid it's your
Right.
baby brother, you're going to do it
Yeah.
without a mask.
So so that's why either you have a keychain or you go into your first aid kit. Like I showed you have a mask like this that folds up into a pocket mask. That's what it's called actually. This one here is called a pocket mask. This attached to my non-rebreather breather. Non-rebreather breather, which you guys don't have, it's more for EMTs. They'll have stuff here because there's all fancy stuff, not just oxygen. But if someone has asthma, there's other chemicals, and that's where the medics and they can do a lot of fun stuff to give better oxygen. But
Wilensky, what if it's a camper?
a camper.
A camper.
Yeah, so you have to get your first aid
Is there a
kit.
risk? No, is there a risk if you don't have a mask? You're on a trip, but you don't have.
Right. So you guys know,
What's really the risk?
in
You
our
don't have-
camp,
you don't have health
in-
checks. And you
right, and what do you call it, camp? CGI Merrick? What's it called?
Yeah.
CGI Merrick is only for posh, fancy, high class,
You don't
well,
get checked.
family.
Medical records.
And I'm and everyone. So usually, when I was first a counselor, I was in Boston, and then I was in California, and I was just certified for CPR. But already then I said I want to be a instructor one day. And this is an Israeli guy in California, and I had a case where a kid had a nosebleed. That's again, sorry, first aiders. I hope I'm giving you enough entertainment that you're not bored yet. They want to leave, right? But that's first aid stuff, which is right after this. A nosebleed. We'll get to the details soon. But a nosebleed is probably one of the most common things we'll have. And there's a way to stop it and prevent it and all that. And I remember at the time I was new, it was my first camp or whatever it was, and maybe I didn't have gloves or I didn't wear gloves, whatever the case was, I got blood on my hand. And there was a lifeguard. The lifeguards are cooler, right? I must be a lifeguard. I missed my class went, I missed the thing, I want to be a lifeguard. And the lifeguard there, he's like, oh my gosh, are you crazy? You got blood on yourself, you're gonna die, like right away. I was like, and then I couldn't sleep that night, I'm like, oh my gosh, I got this blood on me, and I was like, ready to die, like I'm gonna disease, right? And then, if you have a cut necessarily, if you're gonna drink the kid's blood, if you're gonna really do that, but we don't know what we have, we always get cuts. You could serve food, you think you're having fun, I have it to me now, I have it to me all the time, that cuts my fingers. You take a 9x13 pan, and you take the lid off, and you do it slowly, you're getting a cut.
Mm-hmm.
There's no way you're getting a, And if you have a cut, and then then you have a problem. You have to be careful. So we wear gloves, we were protected, so mouth to mouth. If it's your decision if you feel safe, and if you don't care, they're gonna sue you because you gave the kid a disease. Cause I don't know where you were last night. That's a problem. That's why we always be protected. So again, you always have a mask.
Like Sir Wilensky, I think it's important for them to know what to do.
Doctors said be protected, and we're
If
trained.
there's no mask,
But you have
we
to have a
have
mask.
in camp that comes with a medical record, comes vaccinated, comes with everything.
We have
We
masks.
have masks, Rabbi.
Everybody has masks.
Everybody
You
should have
supplied
one.
masks for us, yes.
Everyone got one?
Yes.
Cause I brought extra. Where
We
we
have
at?
a bag of masks over there, so.
Give Rabbi a mask.
You have to hold the nose. You have to hold the
Right?
nose.
We're gonna pass it around. Can you spoon on this plate?
Aye.
All right, now you have two. Double or nothing. You have
Pink
two
one,
for
a pink one and a
car
green one.
keys and for the office key. So everyone, good. You guys see, I told you you're in a good camp, in a posh camp, and everyone has their own mask. Don't play with it. I have these at home. My kids open them up, and then they're gone because it's hard to put it back or it gets dirty, contaminated, it's not clean, and et cetera, et cetera.
Is it
Okay?
only one time?
These are one-time
Yes,
use.
yeah.
It looks like
It costs $1.
Yeah.
No,
Talk
No,
to
it's
plastic.
Stargate.
Plastic bag.
I never opened
Ask
mine.
them,
Don't.
"Yes, orange boxes, they-
No, that's why I never opened it. So I didn't want to.
Yeah, you just
A
put
couple
it
of
on
things.
the
I
The
have
last
them
day
hanging
of
by my
camp,
stove.
if you use it, you're done.
I didn't even.
Don't come to Astrid
Don't open it.
at 4
No,
o'clock,
it's
Stargate.
the
done.
last day of camp, and say,
She's
I guess my
opening
sister
it.
get another one. No,
That one's not a
you'll get one next year.
It is.
They're done. All right, you say
No, they're not.
you get replacement until the last day of camp. If Astrid is nice, then she'll give you another one, and you may choose the color. Okay, so we're trained. The answer, the short long answer is
Stargazer
that we have to be
will,
protected all the time. Us and them.
I
use a
like
mask.
that.
Of course, if you're somewhere and you don't mind, like I said,
It's
getting
gonna
sick and all
stick
that.
too.
If it's your husband, wife, daughter, son, mother, your mouth to mouth is actually the best way because there's no separations. You're giving them the best powerful oxygen, unless you're in the hospital. You know what I mean? So again, if you have a non-rebreather mask,
No,
you
get
have
one
this
after.
mask from the pocket mask. It's better than using but actually your keychain. You would use your keychain and the pocket mask to do your CPR. Okay, so there's no lock on this, so it should be able to access. This is what it looks like. So you guys see it? I don't want to touch it. The battery's live. These batteries could last 10 years. You see it's blinking, right? Sometimes we have to check this before camp to make sure, because it's considered for 10 years or 20 years. These used to be massive, big, like computers. You kids don't know what that means, or like a cell phone. Phones used to be big and large. These used to be bigger, and now they have something smaller. And you have equipment here. Inside, you might also see razors. What's a razor for?
Cut the clothes off.
No, cut the
So-
clothes.
So ladies, you guys are better, and there's no guys
Hair of the
here.
men's
I'm the only
jacket.
guy here, and I'm gonna stay modest, but I do have like some other hair on my body And like, remember I tried doing the mask, and I think for a second, so I pressed hard because just the plastic maybe didn't read the skin. This
So it's a shaver, not a
This
razor.
texture is like skin texture, and it stops for a second.
Off the chest.
If there's a lot of here,
Yeah.
we're
Wow.
going to town. We're doing some shaving.
Get me one.
Okay.
Joe.
We have to do that because we want to be. It has to go on skin. And guys, if you notice, the position is important because you may notice for an elderly person, hopefully it's not for a kid, but some kids have conditions. You might see something here, whether it's from a smoking patch and or someone had a surgery, a heart surgery, and you can notice the way it's cut. If it's cut, sometimes the surgery is down the line, horizontal or vertical, and you would see it, and that's why, because it's a pacemaker. And you put the pad on the pacemaker, it's metal, and you're gonna kill someone. Then do that, which is why you shouldn't touch them. Why by a pool where there's water? You make sure there's electricity. If there's water, and you're not touching the patient, but you're zapping the patient, the water is going to be transferred, and then you're going to get zapped, and you're going to be passed out. So that's why we have to stay clear, and especially if it's a crowd, make sure. So speaking of which, if you're in a camp sitting and there's a crowd, it's very common. It's called rubbernecking on traffic if you drive, and everyone wants to come in and watch and see. It's normal, especially you guys know it. If you say, don't look, what's everyone going to do?
Look.
Right? It's our nature and instinct. So we have sometimes a case and responsibility to protect to be modest and to protect the privacy of the patient. And one of our jobs is to, if there's other staff, first of all, we need ear, we need space to try to give a perimeter. Next topic is, more importantly, they have a female. And if it's an adult female, there can be more private parts and they have to be protected. And someone mentioned the clothes, the razor is for shaving, but usually as an EMT, I'm not sure if you have it here, as EMT we usually have the big scissors where we're cutting heavy stuff, but if there's a girl and wearing a bra, that could be in your way for two things. Number one, it could maybe be in the way for CPR depending on what it is, but most importantly, when it comes to AED, because some bras can have a metal wiring, and that's a problem to have. So we're gonna have to maybe cut the bra open if it's too hard to get the strap off, and that's very important. And when we do this, there's lifeguards on the beach and all this in training, is we try to get people to have privacy because nowadays, what's in everyone's pocket, I don't know how, my phone's always dead, but these teenagers, they're always like a 99%. Not only do they always have full battery, but they have unlimited data. I don't know how people could film. My thing, if I film for 10 minutes, I have no memory left. And you have Times Square teenagers who are filming for hours, I'm not sure, it's not even live, it's just, everything is being recorded, and you have to be protected because sometimes they take out the context and they see something, and you're helping someone. Like in Israel, there's a picture of an IDF giving could be a Palestinian Arab child water, helping him, but they crop it out and they take a picture of a mitzvah, of a good deed, and they say, look, this IDF is actually hurting him, and they make it and they spin the story around, which is dangerous and crazy. You have to be mindful and protected of that. So that's CPR. So we're gonna go practice, and then the CPR people can leave it, and then we'll go for first aid a little bit. Just to quickly recap, your 30 compressions, your 32, the leg, the heart. We're gonna go for infant for a little bit. Make sure your arms are locked. I'm gonna go around the room. Don't put your hands like this, you're hurting your fingers. Open your arms like this. Do compressions, 30 to 32, count out loud. Okay, look, listen, and feel. In the middle of the thing, all of a sudden the person's live. Guys, one thing before we leave this corner, when the ambulance comes, okay, oh, help us here. You're tired. Okay, time to clean up. And then, no, you don't touch the straps. Also, for first aid, we'll learn. When you bandage someone, once it's there, you don't take off. Okay? If you have the straps on, you're going to either unplug it if the straps come off, because that's what it does. Okay? You can unplug it, the straps stay on. When you do something, you stay. That's why when you do something, get it right the first time. Because they learn train us in EMTs. When you come with a patient and they're bandaged, they're like, who did CPR? Like, who did this, right? The professional doctors will laugh at you if something wasn't done right. So you have to make sure you get it right the first time. Do it right. We'll go show you a little bit of infant action, and then you guys are going to practice, okay?
Does it matter which hand is over and which hand is under?
No, I'm a lefty. You mean my left hand's in the front? Doesn't matter.
What do you do for a little kid?
What are you going?
So let's get to that.
Do you do adult or?
I have to go get surgery.
So the cutoff age, which says here on the mask here, is 8. An infant is how
What are
old?
you
Who's
gonna
our
do with
moron?
them?
Who didn't that pick on you?
Shit.
been
Entertainment.
told
The
that.
entertainment's over.
Infant.
No,
No.
sorry.
What do I do in infant? Shaking.
Okay.
Upside down.
Up to 2 years, I think.
Too high.
Okay, good guess.
On the
What do you
arm.
say? Infant. What age? How many weeks, days, months, years? What's an infant? According to CPR.
infant,
Up to 2
According to
years.
CPR.
less than 2.
Up to 2 years.
Cameraman?
18
Up to
months.
2 years.
18 months?
Is toddler. Anything under that is considered an infant.
Javi? What do they call you here, by the way?
Hobby.
Javi's good? Javi, what's an infant? Very good. According to CPR, at least, in Red Cross, CPR is 12 months. A child is until 8, usually, or 12. I have many
So
children.
AED, do you do AED on a child? Like,
So,
things like that
infant,
on
oh,
a
shit.
child?
Usually 8 years old. So, infant, you can use the small straps, which one thing we didn't cover, by the way, and it shows on the picture, if the baby, any baby, if they're too small, instead of doing 1 on 1, you'll put 1 on the front, you see a little picture, and 1 on the back. So if it's a 2-year-old, or even a 3-year-old, if they're small, you'll do that too. If they're a very big baby, you can do it like an adult. That you will be the judge to decide. But the average child for CPR will be 8, or until 12, you can have a large 8-year-old and a small 12-year-old. So usually a child is 8, but it could go to why 12. 12 is usually puberty, things are different, right? 8 to 12 for a child.
At 8, that's when you put
If it's a
adult
large
strap.
child,
And
Yeah.
so if it's like a small, like if it's under 8, then you press like the infant button.
yeah, the child one.
Okay.
Okay. Child. So, like I just said, what you will practice with it, stickers would go once on the front, once on the back. There are 2 ways, but usually the natural way, if the baby is laying down, you take now, remember the 2 fingers. You don't want to hurt the baby too much. The babies are more soft and gentle. And with 2 fingers, they're hard and fast. Okay, some of these have batteries. You see that? Let's see what happens. See how I'm doing it now? Okay, there's green lights. It's yellow. I'm not doing this fast enough. See the yellow? Okay, you'll see it. So 30 times, right? See red? It means I stop. It's like wake up. You gotta do it, right? It's red. It's blinking red. I'm gonna start. It turned green. It's yellow. So that means usually that means I'm not doing it deep enough or fast enough. Or means I am doing it good. But I have the 2 green lights. That means I'm good, right? So these lights help you. The lights are weird too. Maybe they don't have batteries in it because it's new. Some of them have batteries. Don't get distracted with the lights, but just make sure you're doing it hard and fast. With the babies, how we're doing breath. There's something called gastral distension. If you give too hard of a breath to a baby or to an adult, you give too much breath, you can cause the breath to go past into the stomach and cause it to bloat, and that's another disease. Make sure you don't get too much breath. So what do we give for a baby? Call it a puff. What fills up your cheek? Right? Puff. For an infant, which is under 12 months, is infant, you're giving puffs. 32, and you're doing it like this, and or I'll give you this demo, and then we'll practice for baby choking. Okay? Because to get the CPR, sometimes baby is first choking, right? And I did this with my 6.5-month-old, who's now has pokies bigger than this, skinny legs. I don't know who fed this kid, right? My baby daughter, and not so big, but she has nice pokies. And the baby is choking, God forbid. What do we do? So there's a way to hold the baby. I'm going to straddle the legs like this. I'm holding the head firm. Maybe you could be screaming or not, so I want to get gentle.
Should you be sitting down?
Yeah, you could be sitting down, and standing, if you sit down, is better for you and comfortable. It's easier if you're sitting down, actually. But if you're standing, if there's no room, you are. But if sitting down is good.
One that would be hard to do.
Right, sit down. But actually practice on my daughter, who was alert, and I was able to do it. I didn't do, actually, but I showed it on video, and I did it. And my wife was watching it, and it kind of worked. I was able to do it for a 6.5-month, 17, 18-pound baby. This is, I don't know, 5, 10 pounds, right? So choking. We look, maybe there's something in its mouth, pinky, right? We're looking there, everything, Phil, baby is, has a pulse, right? Which, if we found Phil the carotid, we're gonna feel the baby, we're gonna go to the upper arm, okay? So over here, if you have muscles, let the show off a little bit, Javi. If you make your muscles a little bit, see that right there? Where's Landon? Landon has a six-pack. So if you make your muscle, you'll see naturally where your arm is. You don't need to make your muscle, but you could feel right where I showed you. So if I make my muscle, you see that line underneath the muscle? If you put your hand over there, I'm feeling it now. You should feel your pulse, and everyone should practice. That's where you're gonna feel for a baby's pulse. So you didn't mention before, right? You're not gonna feel the neck. You're gonna feel for that area right here, the upper arm. Okay? Before you go. Okay? Feel for baby's pulse. It's still there, but the baby's choking, so we're not doing CPR yet, but similar, actually, to for a baby, like we did the Heimlich remover. So we're doing that 5 times, kind of like CPR, or we're gonna do 5 times to help push whatever is forcing out. You notice how I'm holding the baby. I'm actually using a little bit of gravity too. Sometimes baby have slide, sometimes need gravity. I'm gonna do 5 times, and you see where my arm is? Holding the baby, not smashing the face and letting it not breathe, but maybe cradling the face, right? In one swooping mode. Now, I did this last night with my baby who was supposed to go to sleep, but she was being cranky and teething, and I did it with her last night. And in one move, I'm gonna go like this. Face down with gravity while you're sitting, if you can, if it's easier, and you're holding the baby, and what's gonna happen next? I admit that maybe that was a little bit hard, but it's going to be similar to that. You're giving 5 back pulls. And then again, and then again, as gentle, as safe, but as firm as you can. You're doing 5 thrusts and 5 back pulls to get the airway clear until the airway will be clear or the baby's now unconscious, passed out. You realize there's no pulse, and now you're doing CPR. 32, 32. Look for the throat, maybe something came out, and you just need to clear it. And you're doing 32, 32, 32. AED, 32, 32, 32. Until the ambulance comes, etc., etc., etc. Okay? So choking, CPR for infant,
And the
for a child.
infant's head, you also have to tilt back too, like the adult.
So
head?
remember that we don't have that.
Because
The head's
you're
like this.
because you're
There's no
holding
tilting.
it.
There's no neck. Baby's straight. For an adult, you're gonna do it. See here in our toys, we don't have that. For the adult, it's built that the head is right. You can see here. The question: this is built to move. Baby, like we said, there's no neck. That's why we're not checking for a baby pulse in the neck. Okay. We're going to the upper arm. So we did choking, CPR, infant child. Now I have it here. I didn't do something because they don't necessarily train with it. But like someone mentioned, I do have here. This came from my package yesterday. This is a child. This would be for an 8-year-old. So you see, the body is different. The difference in training, what you need to know for a child, besides the basic 32, which is all the same, is when it comes to choking, when it comes to Heimlich remover, you're not going to go to a child. Landon was like my height, right? A little taller than me, right? Thanks for putting that out. Right? But a 8-year-old will be here. You're not going to go to the 8-year-old and, right, work smarter, look naturally. You're going to go like this, and you're going to get that on the knee, which is better, and you're going to come to you want to be at his height. So everything is more done properly. The Heimlich remover or whatever it is, you give him his height when he falls down, you can catch him like this, okay? So that's what you need to know for infant, but it's all the 32 is the same. CPR is the same. The only difference is, right, the baby's usually an infant and smaller than this size, then you can do it for infant mode. But this size and larger, you'll do adult mode. Other things like first aid when it comes to giving aspirin, that's other stuff as well. Now in order for you guys to get certified, and you can see you guys do an action, I have a lot of bodies all around the room. There's a crime scene here. There's 4 bodies here. And you can have, I want buddies. So find your bestie, 2 friends. If Robert Kramer is in the mood of entertainment, we can even watch you guys do the Heimlich remover on each other, which is what we did one time. I still have pictures from 2007. We did it in Ivander's camp in the valley. That was fun. But there's 4 bodies, which means 8 people can get over here. Okay, because 2 per person. If it's a baby, obviously maybe 1 person is doing it, but 1 person is watching, making sure that you test each other. 2 people because there's 2 people CPR, and I want you guys to train, switch spots. So here, there's 2 adults, 2 bodies, 8 people. Then you could trade from 2 people take a baby, and then trade with the adult. There's a baby and adult over here, and in this corner, I have infant, adult, and right there. So there's